Welcome back to our channel, Daily Tale. Today, we're diving into a highly debated and crucial topic, the privatisation of the National Health Service in the UK. The NHS, a British institution since 1948, providing free healthcare for all. But today, it's at the center of a fiery debate, privatisation. With record waiting lists, staff shortages, and political divisions, the government's push for private sector involvement is sparking outrage and hope in equal measure. Is this the lifeline the NHS needs, or the end of its founding principles? Let's break down the plans, the politics, and what it means for you. The NHS is in crisis. Years of underfunding, pandemic backlogs, and an aging population have pushed it to breaking point. In 2023, a record 7.6 million people were waiting for hospital treatment. The government claims privatization isn't ideological. It's a necessary fix to save the system. But critics argue it's a slippery slope toward dismantling the NHS entirely. So, what's actually being proposed? Let's start with Labour's controversial strategy. Prime Minister Keir Starmer's Labour government has announced a major expansion of private sector partnerships. The plan? To outsource an extra 1 million appointments, scans, and surgeries annually to private providers. Supporters say this will slash waiting times without costing patients a penny. But skeptics warn private companies profit by cutting corners. Will quality suffer? And could this drain NHS staff into better-paying private roles, worsening staffing crises? This isn't saving the NHS, it's selling it off piece by piece. Meanwhile, the Department of Health is sending more NHS patients to private hospitals, especially for gynecology and orthopedic care. The goal? Clear 18-month waiting lists fast. But here's the catch. Private hospitals often lack emergency facilities. If something goes wrong, patients are rushed back to NHS hospitals. Critics call this risk dumping, where private firms take the easy cases, leaving the NHS with costlier, complex ones. Infographic comparing NHS versus private hospital costs per procedure. Taxpayers still foot the bill. In 2023, the NHS spent $3 billion on private procedures. Money some argue should fund NHS infrastructure instead. Then there's the nuclear option, replacing the NHS with an insurance system. Reform UK's Nigel Farage has floated this idea, mirroring the US model. Patients would pay monthly premiums, with care tied to employment or income. Proponents claim it boosts efficiency. But opponents fire back. In the US, 40% of adults skip care due to costs. Would this create a two-tier system, where wealth determines health? The government's 2025 NHS mandate promises a digital revolution, shifting care from hospitals to communities, focusing on prevention. But the Public Accounts Committee slammed the plan as unambitious, accusing ministers of recycling old ideas. Their report demands urgent funding for community clinics and tech upgrades. Without it, they warn, the NHS will keep lurching from crisis to crisis. GPs are already overwhelmed. If community care isn't boosted, the NHS could collapse under its own reforms. In Scotland, First Minister John Swinney is taking a different path, doubling down on public funding. His plan invests in local clinics, GP support, and telehealth to keep patients out of hospitals. It's a direct rejection of privatisation, but questions remain. With Scotland's NHS also struggling, can this approach work without UK-wide funding? The NHS isn't just a healthcare system, it's a symbol of equality. Privatisation threatens that. But with the status quo failing, is there a middle ground? Could targeted private partnerships ease pressure without sacrificing fairness? The answer lies in transparency. Who profits, who loses, and who decides. One thing's certain, the NHS's future will define the next election. What's your take? Can privatization save the NHS, or is it a betrayal of its core mission? Drop your thoughts below, subscribe for more deep dives, and hit the bell to stay updated. Thanks for watching. And remember, healthcare isn't just policy, it's personal. Thank you for joining us today on this deep dive into the privatization of the NHS.